this practice test. All right, so if you have not seen the ARRT content specification for their CT registry, this is the outline that they have of how many questions will be asked for each category. So altogether, there will be about a total of 165. And then you have at the bottom right here, those 30 unscored pilot questions. So that's 165 plus 30 that you'll be asked on the registry test. But the 30 unscored pilot questions, those aren't right or wrong. It's just to test people knowledge to see if they can add it to, I guess, the new list of questions for the next year. All right, so I want to give a special shout out to these people who passed their registry. Um, they use my videos, but I don't know what else they use to go along with my videos as far as what else they use to study. Um, so shout out to these people. They passed their registry in October of 2025, and today is November 1st of 2025. All right, so I just want to read the disclaimer because so many people leave comments on my video and they ask me this. So it's here, right here, so you can know. So if you don't mind, please read it. You can pause it as well. But these practice test questions and answers are made to help you all pass your registry exam. Due to the registry board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so that these questions are available to you for free, could you please like, subscribe, and share the video? I would greatly appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like part 3 to these 100 questions and answers. These videos will help prepare you to pass your ARRT CT Registry Exam. If you are not looking or passing the CT Registry Exam for ARRT, it will help for any national board. You can be an international student, it can be another CT registry board. It can help prepare you for any one of those. All right, so here are some poll results. So almost a week ago, as I'm recording this video, I did a poll and I asked people on my channel, on my YouTube channel, how many questions should I put in the next review video? And these are the choices: 25, 50, 75, 100. Majority of everyone chose 100 questions. So, like I was saying, if the video is too long for you, all you have to do is watch as much as you can, pause it, write down whatever number you stopped on, or just remember in your head, and just come back to the video and watch the rest. I think it makes more sense actually to put more questions in the video because it reminds me what I've already asked you all, and I don't have to keep re-asking the same questions that I put in another video. So most people voted for 100 questions, so that's why I made another video with 100 questions. And another thing, as you're watching this video, if you're like looking at the questions and you're like, oh, she didn't ask this, she didn't ask that, I have probably 10 other videos where I have practice test questions and answers. So if you're not seeing it in this video, it's because it's already in another video. And after you go back and watch those other videos, if you still don't see it, then just leave me a comment and then I can just make questions for that topic or category. All right, so if you are new to my channel, I like to read the questions, the answer choices, and then I give you like a few seconds to think about the answer. This is just something I like to do for my page to kind of like stand out from other people's pages. So if anything on the video bothers you, you can always mute the video if my voice is bothering you, You can always take a sticky note and cover up the clock, cover up my face. Anything that bothers you, just cover it up. This is how I like to do my videos, so this is how my format is going to be until I'm tired of it or until I'm ready to change it. So, other than that, we'll get on to the video and good luck on your test. All right, so question 1. Which generation of CT scanners utilize a pencil-shaped X-ray beam? A, first generation, B, second generation, C, third generation, D, fourth generation. Radiation detectors, A, convert electrical energy into X-ray energy, B, convert light into X-ray energy, C, convert X-ray energy into light, D, convert X-ray energy into sound waves. All right, the correct answer is C, convert X-ray energy into light. Scintillation detectors help to convert X-ray energy into light, in which light would then be converted into electrical energy. The solid-state photodiodes semiconductor helps this by using the crystal plates as well. So if I'm going too fast, like I was saying, pause the video or rewind it. I had read a comment where someone didn't want my pauses as long whenever I'm giving you all time to think about the answer. So that's another thing whenever I'm making a video, it's kind of like a lot to take in mind and consider because one group of people may like it this way, one group of people may like it that way. So I just do what works for me, and then just please just work around it if you can. Question 3. The equation for effective milliamperage second or mass is A, effective mass equals CTDI volume divided by true mass. B, effective mass equals pitch times CTDI volume. C, effective mass equals true mass times KVP. Or D, effective mass equals true mass divided by pitch. So for this one, I'll give you a little bit of time to think about it because I think you just need a little extra time for this question. All right, the correct answer is D, effective mass equals true mass divided by pitch. All right, question 4. The hand washing technique consists of scrubbing your hands for at least A, 5 seconds, B, 10 seconds, C, 15 seconds, D, 20 seconds. All right, the correct answer is D, 20 seconds. Question 5. A patient is scheduled for a CT abdomen examination with and without iodinated contrast media. The patient has an IV in their left hand. What is the best flow rate for this type of examination? A, 1 milliliter per second. B, 1.5 milliliters per second. C, 1.8 milliliters per second. D, 2 milliliters per second. All right, the correct answer is B, 1.5 milliliters per second. So the reason why this is the answer is because if you're going too slow, like at 1 milliliters per second, the flow rate is just too slow. The organ is not going to enhance within a certain amount of time like it needs to. And if you're going too fast, you have a higher chance that the IV is going to infiltrate or extravasate. So that's why 1.5 is like the best option for this. And myself as a tech, with my experience, I've gone in ahead at 1.5 and it works perfect. Question 6. Which anatomy structure is the arrow pointing to? I'll give you just a few seconds to think about the answer. All right, the answer is the left psoas muscle. Question 7. The total exposure that the patient receives for the entire scan is measured by A. CT dose index, B. Dose length product, C. Effective dose, D. Multiple slice average dose. All right, the correct answer is B. Dose length product. The dose length product measures the total exposure that a patient receives for the entire CT scan. The equation is DLP equals CTDI volume times scan length. So if you need to pause it to review the equation so that you can remember it, you can pause the video. Question 8. Which contrast agent is barium sulfate considered to be? A. Negative agent. B. Neutral. C. Positive agent. D. None of the above. All right, the correct answer is C. Positive agent. So barium sulfate is used as a positive contrast agent to visualize the GI tract during our radiology imaging scans, such as CT and X-ray. Before I forget, because I know I am, someone put in the comment box that asked me, how do I know? I had made like 100 questions like this, and the person had asked me, how do I know which questions you have are patient care or anatomy or physics? The answer to that is this is a mock exam, meaning this is going to mock how the CT registry exam will be. So on a CT exam or any radiography exam that you take, they're not going to have 30 questions in patient care and then the next 50 questions in physics and then the next 80 questions in anatomy. It's going to be mixed around. That's why this is called a mock exam. And you should know based off the information that you've already studied before you even started watching these videos, you should know which questions fall under patient care, image production, and physics. If you don't know, I can do a separate video explaining that, but I think a lot of people should probably already know that. Question 9. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Carotid bifurcation. C. External carotid artery. D. Subclavian artery. All right, the correct answer is A. Basilar artery. And I already know that image is not a CT angio neck image. I'm also licensed in or certified in MRI. So I pulled an MRI image because you can just see the arteries like the best on that image compared to what I was able to find for CT. So just as long as you know that, you can correlate that to a real CT image. So I just want to throw that out there that I know that's not a CT image. Question 10. All right, so if you are finding the videos helpful, could you please like, share, and subscribe for more videos from me? All right, question 11. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Carotid bifurcation. C. External carotid artery. D. Vertebral artery. All right, the correct answer is D. Vertebral artery. Question 12. Which equation is for the dose-length product? A. DLP equals CT DI times scan length. B. DLP equals CT DI volume times scan length. C. DLP equals CT DI volume divided by scan length. Or D. DLP equals scan length times pitch. All right, the correct answer is B. DLP equals CT DI volume times scan length. Question 13. Which dose measures the risk of carcinogenesis and genetic effects? A. Absorbed dose. B. Dose-length product. C. Effective dose. D. Multiple slice average dose. All right, the correct answer is C. Effective dose. So the effective dose is also measured in millisieverts. So just keep that in mind. Question 14. The primary reason for filtration in CT is to A. To increase low energy X-ray photons. B. To increase high energy X-ray photons. C. To remove low energy X-ray photons. D. To remove high energy X-ray photons. Right? The correct answer is C. To remove low energy X-ray photons. So the purpose of filtration in CT, like I was saying, is going to remove those low energy X-ray photons, which will also reduce the radiation dose to the patient. Question 15. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Common carotid artery. C. External carotid artery. D. Subclavian artery. All right, the correct answer is B. Common carotid artery. Question 16. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. Common carotid artery. C. External carotid artery. D. Subclavian artery. All right, the correct answer is D. Subclavian artery. So to be exact, it's pointing to the left subclavian artery. So make sure you know your right from your left. Question 17. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is C. Internal carotid artery. Question 18. I know there's a lot of arteries on here, but it's just important to know. So I'm just trying to make sure that you all know your anatomy and your arteries. Which anatomy structure is the arrow pointing to? A. Basilar artery. B. External carotid artery. C. Internal carotid artery. D. Subclavian artery. All right, the correct answer is B, external carotid artery. Question 19. Which generation of CT scanners have rotate geometry? A, first generation, B, second generation, C, third generation, D, fourth generation. All right, the correct answer is C, third generation. Question 20. Which generation of CT scanners have a head-only CT system that was developed by Sir Godfrey Hounsfield? A, first generation, B, second generation, C, third generation, D, fourth generation. All right, the correct answer is A, first generation. So, the first generation of CT scanners, which is the head-only CT system, was developed, like I was saying, by Sir Godfrey Hounsfield, and it was put to clinical use in 1972. Question 21. Which generation of CT scanners have a rotate stationary geometry? A, first generation, B, second generation, C, third generation, D, fourth generation. All right, the correct answer is D, fourth generation. Question 22. The system's ability to resolve as separate forms small objects that are very close together is called A, contrast resolution, B, noise, C, spatial resolution, D, temporal resolution. All right, the correct answer is C, spatial resolution. Question 23. Which of the following determines the pixel size in CT? A, field of view and spatial resolution. B, matrix and pitch. C, matrix and field of view. D, pitch and field of view. All right, the correct answer is C, matrix and field of view. Question 24. The CT system's ability to freeze motion and create an image that is free of image blur is called A, contrast resolution, B, noise, C, spatial resolution, D, temporal resolution. All right, the correct answer is D, temporal resolution. Question 25. The normal range for a patient's blood oxygen level is A, 80% to 90%, B, 85% to 95%, C, 90% to 100%, D, 95% to 100%. All right, the correct answer is D, 95% to 100%. To go back to answer that person's question about how would they know if it's patient care, physics, anatomy, or image production? So this question would be an example of patient care because it's asking about the oxygen level for a patient, which involves patient care. Question 26. Which of the following is considered the normal bond value in adults? A, 5 to 15, B, 5 to 20, C, 7 to 25, D, 10 to 15. All right, the correct answer is C, 7 to 25. So just keep in mind that every facility has their own value for their labs. So as long as you know that it's within this range, then you'll be fine. But just keep that in mind because with medical, especially with numbers and research, things are always changing and updating. Question 27. Which level does the abdominal aorta divide into the right and left common iliac arteries? A, L1, B, L2, C, L3, D, L4. All right, the correct answer is D, L4. Question 28. All of the following is considered the branches of the celiac artery except for A, common hepatic artery, B, left gastric artery, C, renal artery, D, splenic artery. All right, the correct answer is C, renal artery. So the common hepatic artery, left gastric artery, and splenic artery branches off of the celiac axis. Question 28. Which thoracic vertebrae level does the celiac trunk or celiac artery arise from? A, T9, B, T10, C, T11, D, T12. All right, the correct answer is D, T12, which is thoracic vertebrae 12. Question 30. Which flow rate is the best for a CT angiography chest examination? A, 1 milliliter per second, B, 2 milliliters per second, C, 3 milliliters per second, D, 4 milliliters per second. All right, the correct answer is D, 4 milliliters per second. So this does allow better visualization of the arteries. So if the patient's IV is great when you are flushing it with saline, don't be afraid to go to 4, 4.5, 5. I've even seen techs get up to like 6. So as long as the patient has a great IV, um, don't be afraid to don't go above 7, but you can do 4, 4.5, 5. But keep in mind that patient does have to have like a 18 or 20 gauge. You have to know where it's located in the patient's body. I have a patient care video where I discuss all of this, so I don't want to bore you with it and dive into it right now. So just check out my patient care video. All right, so if you all do not mind, just leave a comment, just let me know how you all are doing on the questions. If you are liking the practice test questions and answers, like I was saying, don't forget to check out my CT Registry Review playlist. It has all of my videos combined into one area. I didn't realize how much some people don't know how to navigate through YouTube. Like sometimes I get new subscribers and they're like, where are your other videos? Or they request a certain video, and I'm like, I already have made this, so just click on the playlist. The easiest way you can find it is just click on it at the end of the video. And I should have said this at the beginning of the video, but I want to challenge you all to watch the entire video because it has a lot of good information in there. And I feel like if you skip around, you're not benefiting yourself. So, like I was saying, you can always pause the video, watch as much as you can, then just come back to the rest. All right, so here we go. Question 31. Which of the following occurs whenever a large focal spot size is used? A. Decrease in geometric sharpness because of penumbra. B. A decrease in geometric sharpness because of contrast resolution. C. An increase in geometric unsharpness because of penumbra. D. Improves in-plane spatial resolution. All right, the correct answer is C. An increase in geometric unsharpness because of penumbra. So a small focus spot size will improve the in-plane spatial resolution. Question 32. Which anatomy structure is the arrow pointing to? A. External carotid artery. B. Internal carotid artery. C. Internal jugular vein. D. Vertebral artery. All right, the correct answer is B. Internal carotid artery. Question 33. Which anatomy structure is the arrow pointing to? A. External carotid artery. B. Internal carotid artery. C. Internal jugular vein. D. Vertebral artery. All right, the correct answer is C. Internal jugular vein. Question 34. Which anatomy structure is the arrow pointing to? A. External carotid artery. B. Internal carotid artery. C. Internal jugular vein. D. Vertebral artery. All right, the correct answer is A. External carotid artery. So that's why I said try not to jump around, because if you've seen my other videos, I don't think I have these images in that video. So I try to make new questions and answers for all of my videos. And if you do see some similar questions, that's because I feel like you really should know the information. So as I'm editing this video, I'll probably just go back to the beginning and just tell everyone, just make sure that you watch as much as you can. Question 35. Which anatomy structure is the arrow pointing to? A. External carotid artery. B. Internal carotid artery. C. Subclavian artery. D. Vertebral artery. All right, the correct answer is D. Vertebral artery. To be exact, is pointing to the left vertebral artery. And if you just rewind it back to that picture, you can see that that artery is right by the vertebral vertebrae. Question 36. Which anatomy structure is the arrow pointing to? A. Cerebellum. B. Cerebrum. C. Occipital lobe. D. Spinal cord. All right, the correct answer is D. Spinal cord. All right, so I hope you all are enjoying the video, because it did take me a long time to make this video. It almost took a week because I also have work that I have to do, and then my other jobs that I do. So I hope you all are enjoying it, because these are my own questions that I make. Like, I don't copy the questions from no one's book. I just, have the information, then I make my own questions from it. So I hope that you all are enjoying the questions. Question 37. The most important measure of the radiation output for the CT scanner is A. Dose length product, B. Milligray, C. Size specific dose estimate, D. Volume CT dose index. All right, the correct answer is D. Volume CT dose index. Question 38. Which artifact is caused due to a CT system's inability to process the high spatial frequency signal? A. Edge gradient artifact, B. Out of field artifact, C. Ring artifact, D. Step artifact. All right, the correct answer is A. Edge gradient artifact. And like I was saying, I made a video with a lot of artifacts in it. So if you don't see it in this video, I'm sure it's in, like, I have a lot of questions. Think it's in a separate video by itself in my CT playlist. So just click on that video and you can quiz yourself on all of the artifacts. Question 39. An artifact that has streaks or bands that extends from the edges between very dense objects that is surrounded by lower attenuation material is called A. Edge gradient artifact, B. Out of field artifact, C. Ring artifact, D. Step artifact. All right, the correct answer is A. Edge gradient artifact. So edge gradient artifact, it is a form of beam hardened artifact. So when the X-ray beam is hardened by those lower energy photons that is being absorbed by denser material, this can alter how the beam passes through. Question 40. Which artifact is seen in this image? A. Edge gradient, B. Metallic artifact, C. Motion artifact, D. Partial volume artifact. All right, the correct answer is C. Motion artifact. Question 41. The ratio that the table moves with the patient per gantry rotation is called A. Matrix, B. Pitch, C. Pixel, D. Spatial resolution. All right, the correct answer is B. Pitch. Question 42. The common carotid arteries bifurcates into the internal and external carotid arteries at the level of A. C1 to C2, B. C2 to C3, C. C3 to C4, D. C4 to C5. All right, the correct answer is C. C3 to C4. Question 43. Which anatomy structure is the arrow pointing to? A. Lamina, B. Pedicle, C. Spinous process, D. Transverse process. All right, the correct answer is C. Spinous process. I'm going to take a quick guess and assume that you all know your anatomy. So just let me know in the comment box if you all are like good on your anatomy or if you all need more practice with anatomy. Question 44. Which anatomy structure is the arrow pointing to? A. Lamina. B. Pedicle. C. Spinous process. D. Transverse process. All right, the correct answer is D. Transverse process. Question 45. Which anatomy structure is the arrow pointing to? A. Lamina. B. Pedicle. C. Spinous process. D. Transverse process. All right, the correct answer is B. Pedicle. Question 46. Which anatomy structure is the arrow pointing to? A. Lamina. B. Pedicle. C. Spinous process. D. Transverse process. All right, the correct answer is A. Lamina. Question 47. Which term describes the area within the gantry that is considered the entire area that is being scanned? A. Display field of view. B. Scan field of view. C. Matrix. D. Voxel. All right, the correct answer is D. Scan field of view. So the scan field of view is what is selected by the technologist based on the anatomy that is being scanned. The scan field of view can be larger for the body, but it may be smaller for the actual head part of the body. Question 48. Which term describes the area that is being processed and shown on the screen as an image? A. Display field of view. B. Scan field of view. C. Matrix. D. Voxel. All right, the correct answer is A. Display field of view. So the display field of view can be adjusted after you have scanned the patient. Question 49. The CT number for dense bone is A. -1000, B. 200, C. 450, D. 3000. All right, the correct answer is D. 3000. And I made a full video where I discuss the CT house film units and I go over all of them. Like I was saying, all of these can be found by clicking on the link at the end of the video. It'll be like a picture for you to click on. And I also have a lot of these questions in my first 100 mock exam videos. So just watch both videos or all videos to help you. Question 50. So we're halfway there. So if you all made it this far, let me know in the comment box if you all like watched it up until this point. So the CT number for water is A0, B20, C50, D100. All right, the correct answer is A0. All right, so like I was saying, if you made it this far in the video, leave a thumbs up in the comment box. Whenever I see your thumbs up in the actual comment box, and you can thumbs up the video as well, I will greatly appreciate it. I will know that you all like made it to question 50. Question 51. Which anatomy structure is the arrow pointing to? A. Kidney. B. Liver. C. Spleen. D. Stomach. All right, the correct answer is C. Spleen. Question 52. Which anatomy structure is the arrow pointing to? A. Aorta. B. Inferior vena cava. C. Superior mesenteric artery. D. Superior mesenteric vein. All right, the correct answer is A. Aorta. Question 53. Which anatomy structure is the arrow pointing to? A. Left psoas muscle. B. Left ureter. C. Right psoas muscle. D. Right ureter. All right, the correct answer is C. Right psoas muscle. Question 54. Which anatomy structure is the arrow pointing to? A. Kidney. B. Liver. C. Spleen. D. Stomach. All right, the correct answer is C. Spleen. Question 55. Which anatomy structure is the arrow pointing to? A. Kidney. B. Liver. C. Spleen. D. Stomach. All right, the correct answer is B. Liver. If some of the anatomy questions seem kind of easy to you, that's good because you study for it. But I do have people who watch my videos that have not even studied. Sometimes people watching my videos that have not even started their program, but they're getting a head start. So if some of the questions are easy for you, good, that means that you are at a point where you're ready to take and pass your registry. But I'm just putting these questions in for like anyone, like if you know it or if you don't know it, it's just questions that I'm adding. Question 56. Which imaging plane is shown below? A. Axial. B. Coronal. C. Oblique. D. Sagittal. All right, the correct answer is B. Coronal. Question 57. Which imaging plane is shown below? A. Axial. B. Coronal. C. Oblique. D. Sagittal. All right, I'm sure everyone knows this answer, so the correct answer is A. Axial. Question 58. Which CT examination consists of an unenhanced scan of the heart? A. Calcium scoring. B. CT angiography. C. CT coronary angiogram. D. CT chest with contrast. All right, the correct answer is A. Calcium scoring. So with the calcium scores, you do not use contrast whenever you give it to the patient. It's going to look at the heart and it's going to detect for coronary artery disease. Question 59. Which CT examination is shown in this image? A. Calcium scoring. B. CT angiography. C. CT coronary angiogram. Or D. CT chest with contrast. All right, the correct answer is A, calcium scoring. And I do have questions in the previous 100 question video that I did where it has where it's asking you which artery is this. Is it LAD? Is it MCA? Is it left circumference? So I have that in a previous video. That's why this is part 2, because these are new questions compared to the video that's part 1. Question 60. What occurs if milliamperage second or mass is doubled? A, mass does not affect patient dose. B, patient dose will decrease by 1/2. C, patient dose will double. D, patient dose will increase by 1/4. All right, the correct answer is C, patient dose will double. Mass is directly related to patient radiation dose. So if the mass increases, patient radiation dose increases. If mass decreases, patient radiation dose will decrease. Question 61. Which of the following can be placed over an area on the CT image as a circle or square to represent a Hounsfield value? A, display field of view. B, pixels. C, region of interest. D, scan field of view. All right, the correct answer is C, region of interest. So that ROI is pretty much a small circle. Everyone I work with commonly or they normally use like a circle, but you can use a square as well. But it's like that circle that you place over like an artery that you're looking at, like say for example for a PE exam, you can place that ROI or that circle on part of the artery. So that's what the ROI is. Question 62. The ability to differentiate between objects that have similar densities is called A, contrast resolution. B, matrix. C, spatial resolution. Or D, temporal resolution. All right, the correct answer is A, contrast resolution. Question 63. The approximate measurement of radiation dose that is received during a single CT slice or section is called A, absorbed dose. B, CT dose index. C, dose length product. Or D, dose profile. Okay, the correct answer is B, CT dose index, which is the unit is milligray, and this measures the radiation output from the CT scanner. Question 64. Which of the following is the main reason for a CT image with a lot of noise or a grainy image? A, high KVP. B, high mass. C, low mass. D, small field of view. All right, the correct answer is C, low mass. So, if you look at the top image, then you can see this image appears to be grainy. So from the bottom image, let's just say, if you was to increase the mass, I would say you don't have to bump it up by like 100, but if you bump the mass up probably by, and I'm no physicist, I'm just throwing out numbers, just estimating. But if you bump it up by 10 or 20, then you will have a better image. But you do have to keep in mind that this will increase patient radiation dose whenever you do increase the mass, especially if you're increasing it by a lot. So normally when I have to do this or when I normally see it's done, it's on like those PE exams, when a patient has like a large body habitus. So I know on a GE scanner, if you are going like too high, it gives like this notification, or even if you're going a little bit high, it gives you a notification and it's like pretty much, hey, why are you increasing the mass this much? And you just put the reason for it. Question 65. Which abdominal organ is the most common site for blunt trauma injuries? A. Gallbladder. B. Liver. C. Pancreas. D. Spleen. All right, the correct answer is D. Spleen. Question 66. Which timing is the best when imaging the spleen in the portal venous phase? A. 5 to 10 seconds. B. 20 to 30 seconds. C. 30 to 45 seconds. Or D. 60 to 70 seconds. All right, the correct answer is D, 60 to 70 seconds. So if you are confused about what is the portal venous phase, that's pretty much the delay whenever we are doing the CT abdomen and pelvis with contrast scan, and we inject the contrast and it gives us like a timer, and it's like a minute delay or a little bit above. Like sometimes depending on what scanner you're using, it could be like a minute and 10 seconds or so, but that's what the portal venous phase is. Question 67. Which of the following is the best time frame for a patient to fast and be NPO for an abdomen and pelvis exam? A, 30 minutes. B, 1 hour. C, 2 hours. D, 4 hours. All right, the correct answer is D, 4 hours. So 4 to 6 hours is the best time frame for patients to fast before their CT abdomen and pelvis exams. This is because it empties the GI tract and it also reduces the risk of patients feeling nauseous and vomiting. I've had patients who or I've seen patients who probably have vomited due to maybe they ate or they shouldn't have eaten, and it was like a stat ER exam where maybe they couldn't wait those 4 to 6 hours for it to digest and they just vomited. So that can be another reason as well. Question 68. Which organ is the most common site for distant metastasis spread of cancer? A. Kidney. B. Liver. C. Pancreas. D. Spleen. All right, the correct answer is B, liver. Question 69. The portal venous phase for a hepatic contrast enhancement study is between A, 25 to 35 seconds, B, 60 to 70 seconds, C, 2 to 3 minutes, or D, 5 minutes. All right, the correct answer is B, 60 to 70 seconds. Question 70. The arterial phase for a hepatic contrast enhancement study is between A, 25 to 35 seconds, B, 60 to 70 seconds, C, 2 to 3 minutes, D, 5 minutes. All right, the correct answer is A, 25 to 35 seconds. So just think of it like this. Arterial comes first because A is before B. So arterial comes first, so that's why the 25 seconds comes before 60 seconds. You can look at it like that. So the arterial phase is the first phase. Question 71. The equilibrium phase for a hepatic contrast enhancement study is between A, 25 to 35 seconds, B, 60 to 70 seconds, C, 2 to 3 minutes, or D, 5 minutes. All right, the correct answer is C, 2 to 3 minutes. Question 72. Out of the following answer choices below, which time frame is the best for a CT abdomen/pelvis delay scan? A, 25 to 35 seconds, B, 60 to 70 seconds, C, 2 to 3 minutes, or D, 5 minutes? All right, the correct answer is D, 5 minutes. So that delay scan is pretty much used whenever you're trying to see, okay, you notice something in the kidneys or something in the liver, and you're trying to see, is it cancerous? Is it a tumor? Based on after the contrast has been washed out. So that's what that delay scan is for. Question 73. Cholelithiasis is the medical term for A, bladder stones, B, gallstones, C, kidney stones, D, pancreas stones. All right, the correct answer is B, gallstones. Question 74. Which quadrant is appendicitis located in? A, left lower quadrant, B, left upper quadrant, C, right lower quadrant, D, right upper quadrant. All right, the correct answer is C, right lower quadrant. Question 75. Which quadrant is diverticulitis located in? A, left lower quadrant, B, left upper quadrant, C, right lower quadrant, D, right upper quadrant. All right, the correct answer is A, left lower quadrant. Question 76. Which quadrant is the stomach located in? A, left lower quadrant, B, left upper quadrant, C, right lower quadrant, D, right upper quadrant. All right, the correct answer is B, left upper quadrant. Question 77. Which quadrant is the liver located in? A, left lower quadrant, B, left upper quadrant, C, right lower quadrant, D, right upper quadrant. Right, the correct answer is D, right upper quadrant. Question 78. The delayed arterial phase for a pancreatic CT study is A, 20 to 25 seconds, B, 35 to 45 seconds, C, 60 to 70 seconds, D, 3 minutes. All right, the correct answer is B, 35 to 45 seconds. Question 79. A Whipple procedure involves A, removing the appendix, B, removing the gallbladder, C, removing the head of the pancreas, D, removing kidney stones. All right, the correct answer is C, removing the head of the pancreas. A Whipple procedure involves removing the head of the pancreas, majority of the duodenum, which is a part of the small intestine, and a portion of the gallbladder and lymph nodes that is associated with it. This surgery can be done to treat pancreatic cancer. Question 80. So we're almost there. We just have 20 more questions to go. So thank you all if you made it to this part of the video. I think it was just help you with your test. All right, the small intestine consists of all of the following except for the A, colon, B, duodenum, C, ileum, D, jejunum. All right, the correct answer is A, colon. So the colon is part of the large intestines, and the duodenum, ileum, and jejunum is part of the small intestine. Question 81. When the heart is in the relaxation state, this is called A, contraction, B, diastole, C, systole, D, systolic. All right, probably a simple question for you. So the correct answer is B, diastole, which is the relaxation of the heart muscle. Question 82. The contraction of the heart muscle is referred to as A, diastole, B, hypoglycemic, C, hypotension, D, systole. I think some people also say systole as well. All right, the correct answer is D, systole or systole, however you pronounce it. Question 83. A patient with a glomerular filtration rate or GFR of 6 will be considered A, in renal failure, B, is a diabetic, C, is overhydrated, D, is to have a normal kidney function. All right, the correct answer is A, in renal failure. So whenever I'm doing the scan, I always just reach out to the radiologist and say, hey, this patient GFR is below 40. Should I give them contrast? They're on dialysis or they're not on dialysis. And then that radiologist was like, okay, what are they being scanned for? You'll tell them why they're being scanned, like the reason for it, and then they'll decide if the patient really needs the contrast and make sure they go to dialysis, or they'll say, no, do the scan without contrast. Question 84. Contact the radiologist if a patient's GFR is blank and the referring doctor ordered a CT scan with contrast. A, 15, B, 40, C, 60, D, 100. All right, the correct answer is A, 15. Question 85. Which anatomy structure is the arrow pointing to? A, gallbladder, B, pancreas, C, spleen, D, stomach. All right, the correct answer is B, pancreas. Question 86. Which anatomy structure is the arrow pointing to? A, ascending aorta, B, descending aorta, C, pulmonary trunk, D, superior vena cava. All right, the correct answer is A, ascending aorta. Question 87. Which anatomy structure is the arrow pointing to? A, ascending aorta, B, descending aorta, C, pulmonary trunk, D, superior vena cava. All right, the correct answer is D, superior vena cava. Question 88. Which of the following branches off of the aortic arch? A, internal carotid artery, B, left common carotid artery, C, right common carotid artery, D, vertebral arteries. All right, the correct answer is B, left common carotid artery. Question 89. Which of the following branches off of the right brachiocephalic artery? A, internal carotid artery. B, left common carotid artery. C, right common carotid artery. D, vertebral arteries. All right, the correct answer is C, right common carotid artery. Question 90. Which of the following branches off of the subclavian artery? A, internal carotid artery. B, left common carotid artery. C, right common carotid artery. D, vertebral arteries. All right, the correct answer is D, vertebral arteries. So we're almost done. We have 9 more questions to go. Question 91. Which anatomy structure is the arrow pointing to? A, left pulmonary artery. B, pulmonary trunk. C, right pulmonary artery. D, superior vena cava. All right, the correct answer is C, right pulmonary artery. Question 92. Which anatomy structure is the arrow pointing to? A, ascending aorta. B, descending aorta. C, inferior vena cava. D, superior vena cava. All right, the correct answer is B, descending aorta. And I also think it's very important, especially like you should know all of your anatomy, but especially like your brain and your chest and your arteries, because those are things that we scan a lot in CT. I know at the job that I work at or help out with in CT when I do CT, it's like a lot of PE exams that you perform. Question 93. Which anatomy structure is the arrow pointing to? A, ascending aorta. B, left atrium. C, right atrium. D, superior vena cava. All right. The correct answer is B, left atrium. Question 94. Which anatomy structure is the arrow pointing to? A, ascending aorta. B, left atrium. C, right atrium. D, superior vena cava. All right, the correct answer is A, ascending aorta. Question 95. Which anatomy structure is the arrow pointing to? A, ascending aorta. B, left atrium. C, right atrium. D, superior vena cava. All right, the correct answer is D, superior vena cava. Question 96. Which of the following would be considered a mild reaction to iodinated contrast media? A, facial edema. B, seizure. C, urticaria. D, wheezing. All right, the correct answer is C, urticaria, which is known as hives. That's going to be your mild reaction to contrast media. Facial edema and wheezing is a moderate reaction, and a seizure is a severe reaction. Question 97. Which of the following would be considered a moderate reaction to iodinated contrast media? A, sneezing. B, seizure. C, tightening throat. D, urticaria. All right, the correct answer is C, tightening throat. Hives is a mild reaction, sneezing is a mild reaction, and seizure is a severe reaction. Question 98. Which medication would be considered the best treatment for a moderate adverse reaction to iodinated contrast media? A. Ativan. B. Diphenhydramine. C. Nitroglycerin. D. Xanax. All right, the correct answer is B, diphenhydramine, which is also known as Benadryl. Um, Ativan and Xanax can be used to treat anxiety, and nitroglycerin is used to dilate the blood vessels for a CT heart scan, and it is given under the tongue or sublingual. Question 99. Which of the following can reduce radiation dose in pediatric patients? A, decrease mass. B, decrease pitch. C, increase mass. D, increase multi-phase scanning. All right, the correct answer is A, decrease mass. So if you decrease mass, increase pitch, and decrease multi-phase scanning, this is the best way to reduce radiation dose to pediatric patients. If you don't know what multi-phase scanning is, it's pretty much those extra steps that you take in when you're scanning images such as pre-contrast, in between the contrast, delay scanning. That's what multi-phase scanning is. You're scanning multiple phases. All right, so last question, question 100. So, like I was saying, if you made it all the way to the end, let me know in the comment box. Which anatomy structure is the arrow pointing to? A, manubrium, B, rib, C, scapula, D, sternum. All right, the correct answer is B, rib. All right, so if you made it all the way to the end of the video, watched it all the way through, or even if you just seen this part of the video, could you either leave like type 100 in the comment box for me or leave the 100 red emoji for me to know? It just lets me know, hey, I made it to the end. I seen this part of the video. So I just know how often people are watching because it just lets me know, hey, if it helped you all or not. All right, so thank you all so much for watching. Don't forget to comment your score down below. Let me know how many questions you got wrong. If you enjoyed this video, this is part 2. Like I was saying, I already have 100 questions out, so click on the link below to get to it. Also, write down the questions that you missed so you can go back to review it. If you don't mind, could you all just please give the video a thumbs up if you found it helpful for you? Because, like I was saying, it does take me a lot of time to create these videos for you and make up the questions and answers. Because being so I am an instructor for radiology, I make the questions up by myself. I'm not taking a book and putting their questions and answers in the presentation. So it does help whenever I see your comments or if I see your thumbs up because it does motivates me to keep making videos like this. Also, feel free to hit the subscribe button so that you can stay caught up and informed on when I post new videos. Also, you can find my old videos that way. So, thank you all so much for watching. If you want to, you can come back to one of my CT prep videos and just put in a comment box, hey, I passed my registry, something like that. So I know a lot of people does that for my mammo registry review videos because so many people have been passing their mammo test and I always just shout them out and put them in my video. So I'll do the same for CT. Just let me know if you pass. All right, thank you all so much for watching. And if you want me to make part 3, 100 questions, let me know. It doesn't have to be 100 questions. I can make 50 questions if that's more manageable. I can make 100 questions if you would like. So just let me know down in the comment box. Thank you and bye.